this module, in this section, it will be concepts in community medicine. We will be talking about concepts in control, prevention, and causation. So let's get started and let's take it on and let's see how the ride would continue. There might be ups, there might be downs, but stay tuned, stay focused, and please remember, if you keep your focus on like this, on this point, your focus, the whole kainat, the whole universe, the whole energies are going to get focused on this as well. And there is no energy, there is no chance you won't get a seat. So stay focused, right? There might be ups, there might be downs. So, but you have to stay balanced and stay focused. Let's get started and learn about the concepts in community medicine. For any disease to happen, there has to be three things which play a role. So if you see this Mercedes-Benz sign, for any disease in the center, there has to be an understanding of three things. What are those three things? The three things are, you have to understand the cause of the disease. Once you understand the cause of the disease, you should know how to control the disease in terms of how to treat the disease, how to manage the disease. Once you know that what causes the disease, you also know how to treat the disease. Now you are in that elite position to prevent a disease. This is what is elite position, where you can not only treat a particular event, you can even prevent the unwanted events. That is one of the spiritually most advanced way of healing, that you are preventing the disease, and that is what we are going to learn right now. So let's talk about the first thing, how the disease are caused. The disease are caused by the famous epidemiological triad. We have, what is the epidemiological triad? First MCQ. The epidemiological triad is nothing but the agent, the host, and the environment. It is the agent, the host, and the environment. So these three things are called as the triad. I think you all know it from your medicine, from surgery. Everywhere you have these triads, right? So in PSM also you have a triad. So that is the happy triad over here. And that is the agent, host, and environment. But now the MCQ examiner is smarter. They will ask you, what is an epidemiological triangle? So now what is an epidemiological triangle? It is when the agent, the host, and the environment interact. That means the agent is there, the host is there, and the environment is there. When these all things interact, then we have the disease with focus of time, with time in the center. So that means you need to remember four things. That what is epidemiological triad? Agent, host, environment. What is epidemiological triangle? It has four things: agent, host, environment, and time also. And their interaction will cause more disease. That is what you need to remember. But now the examiner is still more intelligent than us, and they will ask you, what is an advanced epidemiological triangle? You already know what is epidemiological triangle, and you already know what is epidemiological triad. What is advanced epidemiological triangle? So you already know that this is the agent, the host, and the environment. In the advanced model of epidemiological triangle, you replace the agent has to be replaced with the causative factors. With the causative factors, that is the web of causation. Multiple factors can lead to one disease. The host is replaced with the population. That is, we are talking about the whole community now. And the environment is to be replaced with the environmental factors, plus the political factors, the social factors, the socio-economic status or the socio-economical factors. You also have to consider the nutritional factors, the cultural factors. So many factors which are external to the host is what is the environmental factors. With, of course, time in the center. This is known as an advanced model or a modified advanced epidemiological triangle. So with that, you cover the concept of disease causation based on the epidemiological triad or the triangle. You should also know another phenomena that is called as iceberg phenomena. You must have seen an iceberg. You must have seen an iceberg anytime in your life, or maybe at least in the movies or in TV. So iceberg is any ice which is submerged in the water. So now the submerged portion of the iceberg, that is corresponding to the inapparent cases, and the above portion which is evident to us, that is known as apparent cases or the clinically apparent cases. So now you try to understand that for any disease, if you want to understand the concept of causation, you have to understand what all factors are causing it. For example, you have to know what are the causative factors. To understand the causative factors, you should also know the population and the other factors. All these have to be implied on this iceberg phenomena. So please remember that larger the lower portion, mark the words that I am saying. The larger is the bigger portion, the bigger is the submerged portion of the iceberg, the more problematic the disease would be for us, for public health people to manage that. Because so many cases of subclinical cases, underdiagnosed cases will actually be hanging around in the community, right? So that is called as iceberg phenomena. MCQ for you. You need to know that which diseases show the iceberg phenomena and which technically do not. The iceberg phenomena is shown by the Prime Minister jumped in a ditch to have a ruby. Prime Minister jumped in the ditch or in a ditch to have a ruby. P stands for poliomyelitis. M stands for mumps and not measles, please remember. J stands for Japanese encephalitis. N stands for influenza. Ditch stands for diphtheria. 2 stands for typhoid. Have stands for HAV and HBV, hepatitis A virus and hepatitis B virus. Ruby stands for rubella. So these are the diseases which show the iceberg phenomena. These are the diseases which show iceberg phenomena. If you can remember, very nice. Otherwise, please remember that these diseases, technically, they always will show iceberg phenomena. Out of these, polio is a very important cause of iceberg phenomena. In fact, do you know that 75 to 80% of all the polio cases, they will always show the iceberg phenomena. Similarly, rubella cases, 40 to 50% of all the cases of rubella, they will have that iceberg phenomena. They will be in the lower submerged portion of the iceberg. Similarly, for mumps, 30-40%. Influenza has highest. Influenza has 50 to 70% of submerged portion. So anyways, all said and done, please remember that these are your iceberg phenomena diseases. Diseases which do not show iceberg. If you want, you can remember these are the TRM, tetanus, no iceberg phenomena, rabies, not rubella, and measles and not mumps. These are the diseases which do not have the iceberg phenomena, and technically these are the diseases which we can control on a public health scale or on a community level scale. So with that, we cover this topic of iceberg phenomena. Let us go ahead and talk about the next section, that is the concept of control, things you need to remember for your MCQ exam. The concept of control. Control can be control, elimination, eradication. So when do we say control, when do we say elimination, and when do we say eradication? So if you talk, you already know that this is the agent, the host, and the environment, and the interaction of this causes the disease. So let us say there is a lot of disease which is happening in an area. You want to stop that disease. How will you do that? You pull back the agent, you pull back the host, you pull back the environment. That's the only way to disintegrate this triangle. So once you're pulling back the agent, you pull back the host, and you pull back the environment, don't you think the triad or the triangle would something look like this? This will be the agent, this will be the host, and very small will be the disease. Can you appreciate? I don't know how much you can on your small screens. Even I can do that on my screen. But anyways, please try to appreciate that once you pull back the agent, the host, and the environment, the chances or the probabilities or the quantum or the magnitude of the disease will decrease. This decrease in the magnitude of the disease is called as a control phase. This tells you that your activities are actually going in the right direction, right? So that phase is called as control phase. MCQs on this. What is a control phase? Please write down. Control phase is the phase in which the disease is no more a public health problem. The disease is no more a public health problem. Next point that we need to do is what is elimination. So see, once your control phase is there, the disease, the magnitude or the prevalence of disease or the incidence of disease, they start decreasing. Once they start decreasing, don't you think at some point in future, there will be a point the agent, the host and the environment, you pull back them so much that they don't interact. And once they don't interact, will you have a new disease? We will not have a new disease. If you do not have the new disease, that technically this stage will be called as elimination phase. So what is elimination phase? Elimination phase is MCQ. The first MCQ in elimination phase is, will you have new cases? There is no new cases. There is no new cases. Second MCQ, why do you have an elimination phase? There is interruption of disease transmission. The agent exists in nature, in the world, on this planet. The host will be there, of course, and the environment is there. So all three are there. The only thing is they are not interacting. The point to be noted, if you are more of that conceptual mind, you will probably try to sync with me and you will understand that if these things are not interacting, you know that the agent is there, the host and the environment, they are not interacting, there will be some further. This is elimination phase. There will be further some point in future that you already know that the agent needs a host to survive. That's what is the nature of an agent. Any microorganism, it needs a host to survive, to go into and replicate, infectivity and pathogenesis. So many things happen. So now this, if you don't let the agent to come up, so you take a scissor and you cut here. If you don't let the agent meet the host, then how on earth the agent is going to survive? After some years, somewhere in future, the host will be there, the environment will be there, and poor fellow agent does not exist. This stage is technically called as eradication phase. Are you understanding how the public health works? From agent host environment, you pull back things, control phase. Once they pull back, they don't happen, that is elimination phase. And once you keep on pulling the thread again, and at some point of time, the agent will cease to exist. There is no more agent. That phase is called as eradication phase. So, bache, please write down in your copies, what is eradication? Eradication means there are no new cases technically. No new cases, and there will be no new cases. Why? What is the hallmark of eradication? The hallmark of eradication is that this is a permanent phase. There is extermination. There is extermination of the agent. So if there is extermination of the agent, that is usually said a permanent phase or a temporary phase. Once the agent is no more existent, this is a permanent phase. Please mind it, a small conceptual understanding for people who are syncing with me. Elimination phase, do you think it will be a permanent phase? Answer is no. Elimination is a pure temporary phase. It's a temporary phase. Why? Because if your activities are very good, the agent host environment will keep on to be disintegrated. But sometimes, let us say you let loose things. So this can any day go back to the control phase. They can any day go back to the control phase. That is what the beauty of public health is. You do the measures, you reach the goal. You don't do the measures, you don't reach the goal. It is based on the simple scientific principles. So that is what is control, that is what is elimination, and that is what is eradication. I think now you are in an understanding that whenever you will watch my videos on national health programs, you will come to know what this program strategy is. Why? Because you will come to know that what is the objective of the program. Like what is the name of this program? National Vector-Borne Disease Control Program. You also know National Iodine Deficiency Disorder Control Program. You also know National Program for Control of Blindness. And you also know National Tuberculosis Elimination Program. You also know National Measles Elimination Program. You also know National Leprosy Eradication Program. So I hope now your concepts of understanding of these national health programs would definitely increase if you once know what is the control phase, what is elimination phase, and what is eradication phase. That is what is important for you to know, that what is control, elimination, eradication. Moving ahead, in the level of conceptual understanding of control, elimination, eradication, you should also know what is isolation and quarantine, because these are also the concepts used in control and prevention. So they are used in control, of course, control of disease or prevention of disease. This will be more understandable if you relate whatever I'm going to say with COVID-19 status. I don't know at what stage in the future you will be watching this video and what will be the future of COVID-19 infections. But as far as today, when I'm recording these videos, COVID-19 is a big headache for everyone. It is a publicly declared pandemic today, and we are doing everything to control this pandemic. And if you use the strategies that we are using in COVID-19 and take this understanding of isolation and quarantine, it'll be, I think, helpful kind of thing for you. So let's move ahead and talk about isolation and quarantine now. So what is isolation? Isolation is primarily done for diseased people. It is done for people who are already diagnosed with disease. You isolate them to one area so that they don't spread to others. They do not spread to others. The communicable disease, right? Isolation is done for how much time? It is done for the period of communicability, which is not very much which is not very much dependent on the incubation period. What is incubation period? It is the time from the entry of the pathogen to the first sign and symptom. But these people have already shown the sign and symptoms, so this is independent of the incubation period. Mind it, this is independent of the incubation period. Coming over to quarantine. What is a quarantine? Quarantine is for people who are suspicious, like you suspect they are diseased. So this is technically for apparently. It is for technically for apparently healthy individuals. Mark the words, write it bold in your copies. It is for apparently healthy individuals. And till what time will you do quarantine? They are actually apparently healthy. So what is incubation period? Time from the entry of the pathogen to the first sign and symptom. These people are not shown sign and symptoms, so they may be in that incubation period. So till what time do we do quarantine? This is for the maximum or the longest incubation period known to us. Incubation period known to us. For that we do quarantine. So mark the words. Apparently healthy is quarantine and diseased people is isolation. Let's dive into it now. Build more concepts, because a lot of times students ask, more specifically people who are going for their PG entrance exam. It's very important for you. Because of the times COVID-19 we have seen, you need to scale up your understandings in public health. I don't know how much. I never thought that I'll be teaching you all this because about isolation and quarantine methods. So anyways, let's get started and let's talk a little bit more about what are the ways of isolation and what are the ways of quarantine. Different types of isolation and different types of quarantine, which we use in case of pandemics and big time epidemics. See, what happens is that the philosophy is that, let us say this is the world. In this world, if you are born in this world, you will be at risk to the disease. So you become at risk because you are born. You become at risk, right? There is no person who's not at risk and he's born on this planet and there's no risk of disease. It doesn't happen like that. So you become a susceptible, right? And now just imagine that in this world there are some buckets, some jugs. Again, we'll be using this whole concept again in epidemiology. So if you do it now, it will be easy for you. So just imagine that in this world there are jugs. There is a jug for prostate cancer. There is a bucket for esophageal cancer. There is a bucket for influenza. There is a bucket for pneumonia. There is a bucket for diarrhea. Some people will fall in some bucket sometime. Some people will fall in, unfortunately, many buckets at the same time. So it depends on your kismat, it depends on your luck, and depends on so many factors, on your health factors, social factors, host factors, environmental factors, so many things. So many people will fall into one jug, many people will fall into maybe, unfortunately, many jugs at the same time. So all said and done, the point is, let us talk about one jug now. Let us say a person falls into this jug. So now this person could either be recovery, that is, they get cured, or unfortunately they will die and they are out of the universe back again. So that is what is the born and the die. So a person is born and the person dies. Are you understanding this? This is the concept of life on this earth. So now, once you understand this concept of life on this earth, now let us use some mathematical and scientific principles on this life. There is a birth. If you are born, you will be called as susceptible. If you are susceptible, after some years, there is a finish line, that is a death. Everybody would reach that finish line. So everybody would have a start line and everybody would have a finish line. In between is the susceptible. Now, there are some susceptible cases who will land up into the infective people. I'm talking specifically for epidemics and communicable diseases. So there may be some people who might be infective. Infective people might someday land up into a recovery stage. People who recover will also land up into the death sometime. People who are infective, they can directly reach the death sometime. I don't know, it may happen that people who have recovered, they may get susceptible and they again may get infective. There are many diseases where the person is not immune to that disease again. You get dengue again. You get malaria, you can get malaria again. So if you get influenza, it doesn't mean you won't get influenza again. So in fact, in COVID-19, we see that the IgG antibodies, they are lasting not more than 3 months. So people might get COVID-19 again, people might get infections again. So from recovery again, you might land up into susceptible. Are we okay with this? So this is what is called as the infection cycle. So once the infection cycle is there, how many people will be susceptible? Let us say this is given by a symbol alpha. So the susceptibility rate will be alpha. So what is alpha dependent on? Alpha will be dependent on the birth rate of the population. The susceptible will enter into infective. The susceptible, let us say, how many susceptible will become infective? That is, let us say, I'm just denoting it by the word beta. Let us say beta will tell you what it is, the infection rate of the disease, infection rate, or what we call as the infectivity potential of that particular agent. Let us say after infection, people would recover. Let us say that this is gamma. So what is gamma? Gamma is the recovery rate. Gamma is the recovery rate. Are we getting this? So now try understanding this. Birth rate or the infection rate or the recovery rate are going to govern everything. You have to protect the susceptible from getting into the infective stage. So now this is understanding that what are the models of control. So what are the models of control? If you understand this, models of control. The models of control can broadly be classified into two types. You can have a spatial strategy or you can have a non-spatial strategy. Non-spatial strategy. You can have a spatial strategy or a non-spatial strategy. If you are very clear with this diagram, then you go ahead. If you are not clear with this diagram, please pause this video, rewind this video, listen to me again when I'm explaining this diagram, and then restart. So once you are very sure, let's move ahead. This is a spatial strategy and a non-spatial strategy. Non-spatial strategy means without any space discretion. So examples for this could be two examples. Either you increase the recovery rate or you decrease the people getting this infection, you block the beta. So how will you block the beta? You invent any vaccines. Are you understanding that why in COVID-19 today we are behind the vaccine? Because that is going to stop the susceptibles from getting infected. Or you increase the recovery rate, that means you start treating them. This both will be called as non-spatial strategies. Next, we also can talk of something called as spatial strategies. Spatial strategies is when you block some people, in some spaces. So that is what is isolation and quarantine. Next we come over to is what is isolation and what is quarantine, or what is this spatial strategy. The spatial strategy can be isolation or quarantine or cordon sanitaire. Cordon sanitaires or isolations or quarantines. Cordon sanitaires, I think in non-technical language, people who are in police or people who are in administration, they will say the buffer zone. You must have heard about the buffer zones or the containment zones. So that is all based on the spatial strategy. Let's go ahead and look a little bit more about the spatial strategy. The spatial strategy, specifically talking I'm now, is about the isolation and quarantine. So the spatial strategy can be of two types. That can be, first let us talk about the names of this. That is called as defensive isolation, or we can have an offensive containment. Offensive containment or defensive isolation. In defensive isolation, you take the disease people. Let us say these pink color people are the disease people, and outside are the green colored people. That is, they are susceptibles. So you contain them in a particular area, the disease people, so that they do not cross this line and they do not infect the susceptible population. This is what is the COVID wards. COVID wards or the isolation wards, and this is what is isolation. It is called as defensive isolation. This is the very usual scenario that we employ whenever we are managing any public health emergency. On the other hand, we can also have offensive containment. What is offensive containment? Offensive containment is exactly opposite of defensive isolation. That is, now you have the healthy people inside and you have the diseased people who are roaming outside. So you make a barrier somehow so that the healthy people who are inside, they remain inside. This is what you technically called as, so that the diseased people, they cannot come and infect the healthy, right? This is what you technically try saying this is what is lockdowns. Are you understanding why do we do lockdowns in COVID-19? Are you understanding why do we build COVID wards, or why do we have the containment zones? One is offensive containment, one is defensive isolation. So you contain old age population, you contain children in their homes only, so that they are remaining safe, while outside everywhere the infection or epidemic might be spreading. Moving further to what is quarantine. Quarantine can further be of two types. You can have a absolute quarantine, or we can have a modified quarantine. We can have absolute quarantine or modified quarantine, nothing very special. In absolute quarantine, there is absolutely no freedom of movement, no freedom of movement whatsoever. That is a total absolute quarantine. This is 100% lockdown. We can also have a modified quarantine where there is partial relaxation or partial limitation. So we can have a partial limitation of movement, or we can have a partial relaxation of movement. This is what we have seen in many states where the COVID-19 infections were not so much. In those states, we made the working hours as 7 to 9 or 9 to 10, and or Saturday, Sunday, there is no work to be done. So it depends. This modified quarantine could be based on hours, like time. It could be also based on the businesses. Some of the businesses will be allowed to be open. Some of the business were not allowed to be open. Cinema halls, theaters, they opened very late. So it could be based on the time. It could be based on the type of business. It could also be based on the special age. Like the school business was not open quite until recently because of the special age group that were potential of causing more spread rather than having the disease. We can also have that funda or concept of immune passports. Immune passports, that is that people who have that immunity card, they will be able to work. So, but all said and done, the quarantine requires very high amount of serosurveillance. It requires very high amount of serosurveillance to be done at all the levels, in fact. So that's all about the isolation and the quarantine. Apart from this, there is another concept that you can read is about the segregation. Segregation concept. So what is segregation concept? Nothing very special. In segregation concept, we will keep our children in a particular area that is segregated so that they don't interact with others. That is what we call as buffer zones. So building buffer zones or building segregation zones for special age group children. It is for separating special age group population. Specifically talking, you can either have the old age group who are more vulnerable, or the children. This is what is establishment of the cordon sanitaire. Cordon sanitaire. Cordon sanitaire, and that is what is the sanitation areas or the cordon areas, they have been cordoned off. So it is a technique that we use in modified quarantine. It comes under the modified quarantine, where special group of people will be moved to a special location so that the infected population may not affect them. So this is what you need to remember, that this, what you see right now is the infection model. I will be using this infection model again in epidemiology, but all said and done, this is the basis of doing isolation and quarantine. So with that, we finish this topic on concepts in control. Next, let us talk about the concepts in prevention. I think we all know what are the levels of prevention that you already know. We know that there could be primordial prevention, primary prevention, secondary prevention, or tertiary prevention. You also know that there could be a risk factor. Risk factor leads to disease. Disease leads to complication. Complication leads to disability or unfortunately death also. So let us say that a person is doing some activity so that the risk factor is stopped. The risk factor, you don't let it emerge. If you don't let the risk factor emerge, of course, common sense, no disease, no complication, no death. What is this level known as? Please remember, this is called as a primordial prevention. So that means, what are you preventing? You are preventing the risk factor from establishing. You are preventing the risk factor from coming up. So mind the words that if the risk factor is there, you take it down. You don't, you treat the risk factor. That treatment of a risk factor is not technically primordial. Primordial is prevention of the establishment of the risk factor. So if you don't let, mark the words, if you don't let the emergence of risk factor, no emergence of risk factor, that is called as a primordial prevention. What is primary prevention? Let us say the risk factor is there and somehow you do something that the disease is blocked. So the disease is blocked. So if the disease is not there, that means whatever you're doing with the risk factor, either you're treating the risk factor or you are decreasing the risk factor, whatever you are doing, you're not letting the risk factor come up to the disease. This is known as a primary prevention. So of course, no disease, of course, no complication and no disability. Now, by chance, let us say that there was a disease also. Of course, if the disease was there, the risk factor must have been there. Let us say you do something, I don't know how you did it, but you did something that somehow the disease was stopped there and then. And it did not progress to complication. So, of course, if it did not progress to complication, that means there was no complication. If no complication, of course, common sense, there is no disability or no death. This level of prevention is called as secondary level of prevention. And let us say last scenario, I think everybody must be knowing it by now, that let us say that there was a complication also. And in case there was a complication and the disease was there, the risk factor was there. And you do some activities so that the disability or the death is stopped. So now if the disability or the death is also stopped, what level of prevention are we doing? This is technically called as the tertiary level of prevention. So basically, I have made these circles with a cross inside. Can you see them in a pattern, in a design? They are there. That's a reason. It's not to show you some design over here. There is a reason for that. Reason is, in your MCQ exams, do not, mark the words, listen to what I'm saying, do not think of what you are doing. You think of what you are doing to prevent what. If you can do that, I think all the controversies in this whole universe which fall on this levels of prevention will be gone. MCQ will be water for you. Think of the MCQ based on what you are preventing. If you are preventing disease, it is a primary prevention. If you are treating disease, that means disease already there. That is a secondary prevention. If you are preventing disability, it is a tertiary prevention. If the disability already there and if you are preventing the disability or the death, that is a secondary level prevention. And if you are treating the disability, that is a tertiary level prevention, right? So please remember that if the complication has already occurred, that would be a tertiary level prevention. If the complication is yet to occur, that would be a secondary level prevention. So based on that, you would be able to devise almost every MCQ. You will be able to answer every MCQ by yourself. Let's have a look at some of the MCQs which can be asked to you. So let us say that a child is or a person is, let us say a normal young adult is 18 years of age and he is doing yoga at home. He's doing yoga at home. What level of prevention? This is technically a primordial prevention, lifestyle modification, or mark the words again. He's promoting his own health. That is health promotion. That means he's already in the state of health and he's promoting that. Let us say a 50-year-old male is doing a yoga, who is having hypertension or whatever. So if it is a 50-year-old male, let us say he's not having disease, 50-year-old male who's doing yoga, now because of his age, he might be at risk of having disease. Now he is doing yoga. What is this? This is also lifestyle modification. But is he at risk? Yes, he is at risk. So this is not technically health promotion. This is basically lifestyle modification and disease prevention. But you can say, I'm not there are overlaps, right? So this can be, people would like to put this as health promotion also, that whatever his health status is right now, he wants to keep that status only. So anyways, there could be overlaps, but the point is 50-year-old male who's at risk because of any disease, metabolic disease or cardiovascular disease, because of his certain age, this is not a primordial prevention, this will be a primary prevention. Let us say a 50-year-old male who is a known case of diabetes, he is doing exercise, physical exercise and yoga to probably take care of his diabetes. What is this level? This is a secondary level where he is trying to keep the diabetes under check. Let us say a 50-year-old male is there who has got a lot of leg problems because of diabetes. He's got neuropathy in the leg, and he's also got respiratory problems, and because of that he's got pulmonary fibrosis and so many problems he's had due to diabetes for since long, and now he's doing yoga. What level of prevention? This is actually a tertiary level of prevention. So the same person doing yoga all the time, the MCQ can be asked in whatever manner. Mind you, the manner of MCQs is going to define what the answer is. The words don't matter. 50-year-old yoga doing. So 50-year-old person doing yoga could be anything. So anyways, this was just to enlighten you, or I'm trying to tell you that there could be overlaps. Anyways, let's get started and talk about what are the MCQs you can get over here. Please remember that primary prevention could also be lifestyle modification. Other examples for primary prevention could be health education, where you are educating a person about various type of diseases and their effects on life. The examples which are not overlapping, so lifestyle modification, health education is a general thing. Examples which are not overlapping, these are hardcore examples. These are immunization is a pure primary. Whenever you get a question, measles immunization, HPV immunization, HIV immunization, COVID-19 immunization, measles, diphtheria, tetanus, whatever immunization, all are primary prevention. This comes under the category of specific protection. It will be coming under the category of specific protection because measles immunization is going to prevent measles only. It doesn't prevent tetanus, right? So specific protection, that is what is immunization. Other examples for primary prevention, let us take a separate page and we can write down easily. Immunization. Second is family planning methods. Family planning is in the sense that the person is at risk of increasing the family. They are using family planning methods. Chemoprophylaxis. Food safety, the food nutrition guidelines, all the food guidelines. RTA, the police control measures like wearing helmet while driving is all type of primary prevention. Use of mosquito nets or repellents is all primary prevention. You are having that risk factor and you want to prevent the risk factor, you want to prevent the disease. So all these are examples of primary prevention. Next we come over to is the secondary prevention. Examples for secondary preventions are particularly easy. So you try understanding what did we talk. In secondary prevention, the disease is there or not, the disease is there. So once you know that the disease is there, you have to prevent the complication. How will you prevent the complication? By early diagnosing. Simple as that. So what is secondary prevention? That is early diagnosis. How will you diagnose the disease early? Probably by answer screening. So what is screening? Screening is an essential type of secondary prevention, no overlap. Prompt treatment. Prompt treatment is also a type of secondary prevention because you are treating the disease. Example for this is giving DOTS therapy for tuberculosis, giving MDT, multi-drug therapy for leprosy cases, giving artesunate combination therapy or ACT-SP or ACT-AL or chloroquine for malaria. What is this? This is all types of secondary prevention. What is tertiary prevention? Again, there could be a slight confusion, a slight controversy over here, but let us try to solve that. Tertiary prevention. Tertiary prevention means what? You are preventing the disease or you are preventing the death. So the modality is to prevent a disability or prevent a death in case the disability is there. Prevent a death. So in case the disability is already there. So that is what is a tertiary prevention, right? How are you going? Give me an example for tertiary prevention. Tertiary prevention could be disability limitation. So try understanding the word that disability limitation can also be secondary. This is again an overlapping point. This is also again an overlapping point that disability limitation can as well be certain situations we can have secondary prevention. But technically, if you get an MCQ, please mark disability limitation as a tertiary prevention. What do you mean by disability limitation? Let us say a person gets fracture of the hand. So if I get fracture of my hand, so my hand is fractured now. I should be putting a cast on this, because if I don't put the cast, there may be malunion, non-union, whatever. So that means what is fracture? Fracture is actually a complication of fall, right? So therefore, because it's a complication of fall, you should be using some measures to avert a disability, permanent disability. So using a cast over fracture, resting the muscle. Right now, let us say my shoulder is aching by sitting like this for a long time. I'm resting my muscle now. So this resting of the muscle is to prevent any permanent disability to that. So resting of muscle is in cases of any trauma or injury. That is again a disability limitation. So all these are examples of tertiary level prevention. We can also have tertiary level prevention as disability rehabilitation. Disability rehabilitation. So disability rehabilitation could be like use of reconstructive surgeries. In case of leprosy, we do reconstructive surgeries. Or you can also talk of rehabilitation as opening of blind schools in different areas. Use of any mobility aids, transplant surgeries, use of prosthesis. If a person's leg is cut and you give him a new leg, what is that? That is disability rehabilitation. Disability limitation and disability rehabilitation are again tertiary, but rehabilitation does not have overlap. Disability limitation may have certain overlaps. But if you get one MCQ that disability limitation is what type of answer? Answer has to be a tertiary level of prevention. Beyond this, just for students who wish to learn even more, there is something called as a quaternary prevention. Quaternary prevention. It is an upcoming concept which has nothing to do with the primary, secondary and tertiary levels of prevention. Quaternary prevention, it is a new concept in which we try to avert or try to stop the people from over-diagnosis, prevent the people from over-diagnosis, especially in bigger multi-specialty hospitals or tertiary care hospitals, because of evidence-based medicine, or because of unapproved guidelines and so on and so forth, and offer ethically proven treatment or investigation choices. So many diseases, they have started to increase because of evidence-based medicine, because of a lot of publications happening, and that causes a sense of over-diagnosis in the population. So to prevent the over-diagnosis in the population because of so much research into areas, we do a special type of prevention that is known as quaternary prevention, but that's an upcoming concept, and it could be a prospective MCQ for you as well. So with that, we finished this whole topic on concepts in community medicine, where we talked about the concept of causation, control and prevention. So congratulations for finishing the first module. Thank you.
Hi guys, please subscribe my channels.